the head of the Department of Health Policy and Management here, and have been director of a rural health research center for over 2 decades that's federally funded. And I've been thinking, is everything we've done over the last 20 years, is it meaningful in today's world? And so traditionally, when we think about rural health, we think about isolated areas, places where we don't have lots of physicians, nurses, and others, places that really aren't considered when we think about developing policies out in Washington, D.C., and whether it's how we pay people or how providers get trained, et cetera. These policies really are very urban focused and have an urban bias to them. And so we all live, most of us here at least, not all of us, live in the Twin Cities and not used to this isolation. Historically, what's been the traditional remedy in terms of how do we get people healthy in rural areas? You have Marcus Welby, or the solo physician who 24/7, 365 days a year, that person would be the savior for the community. But these days, you can't get clinicians who want to be on call 24/7, 365 days a year. And the new challenges I think about in the context of rural health are, do we have broadband access in the context of, can everybody get access to the internet? Can we get telecommunications and telehealth into rural isolated communities? We talk a little bit about health literacy and education, and we are going to be more responsible for ourselves in the future than we have been in the past with all these gadgets and stuff, and the notion of health literacy is really, really important. And when you look at the different kinds of headlines you see in the newspaper, Supercomputer helps Minneapolis doctors with cardiac decisions. Decisions on whether you should have surgery or not and have invasive surgery are now not made locally, they're made remotely. And this opens up a whole new agenda in terms of how people can get taken care of in rural areas. And then we see notices that increased mortality in rural areas is 13% higher than in urban and suburban areas. And why is that? Is it the increase of opioid use? Is it because we don't have primary care out there? Is it the lack of education? There could be a whole host of reasons. But there's real concern back at the federal level, at the state level, about these drops in life expectancy and increased mortality and what we can really do about that. And the federal government finally has decided, rather than developing delivery care system options, maybe we want to look at things called accountable health communities, where we're really saying, let's look at the social needs of the people living out in rural areas and not just focus on, do we have a doctor there, and see how that impacts costs, health, and care quality, because everything we've done up to now has been, at best, modestly successful. So are there other kinds of approaches for trying to deal with improving the population health? And when you start thinking about these kinds of issues, the trade-off that comes into place is the notion of independence versus stability. And what does it mean in this day and age to be independent, i.e., not linked, or does it mean linked in different ways where the patient's more engaged, but we have all these self-monitoring devices in the future that we're going to be taking care of ourselves, and then there'll be messages sent to remote providers. And the trade-off historically has been, if you want to remain independent, your stability, both economically and otherwise, is threatened. And so we've been involved with a couple of people here, Sarah Gallus, Michael Oakes, and other at the university, in terms of looking at what really does create better health. And the Robert Wood Johnson Foundation has started a new program called The Culture of Health. And the kinds of things we're saying we need to look at are housing stability and quality. What are the mortgage rates that are available to people out in rural areas so they can really purchase stable and high quality housing? Food security. Walmart just announced that they're going to close 150 stores, many of them in rural areas. Well, the other side of that is, in many of those areas, that creates a food desert when Walmart, the big evil villain, closes up. It creates a larger problem. Education, health literacy, we talked a lot about in terms of what kinds of options are really out there in rural areas to try to accommodate that. Reducing interpersonal violence. So do you feel safe in the environment you're living in? That creates better health. And I think the punchline of all this is that these are a different way. It's a different way of looking at how can we improve the health of populations living out in rural areas than the traditional ways, which simply focus on getting more providers, trying to create economic or other incentives to get providers out there. There's a whole host of other issues that we really need to think about. And I see that as a really rich agenda for our research center that we'll be moving forward on. So.